Great. Thank you for everyone for joining us today. I'm really excited to have Dr. Roseann here with us. She's a longtime friend, and I've worked with her professionally. And so I'm just going to tell you a little bit of about Aspire, and then we'll get going. So we are a nonprofit, a small nonprofit based on providing usable information and tools to empower our community so that we can't be there for every single moment of your lives, but we need to be able to give you the tools to sort of advocate for yourself, advocate for your child, understand these complex disorders, so that we can improve the lives of our kids. And so in doing that, we pretty much target 5 core audiences. Obviously, the national general public, because we always want to increase awareness and understanding. It can't just be awareness, of course, of this disorder, so that more people have their ears pricked up to what the signs and symptoms of this disorder are. They may not know everything for a while about it, but at least they've heard of it. We want to, before we can ever figure out how to get to the end of less kids getting this, we need it to become a household word so that people say, oh yeah, well, it's PANS, and not go, ooh, what's PANS? And in doing that, we also want to be supporting our families and our patients, which is the core of our audiences, help them understand, give them lots of tools with our website and our toolkits, our one-on-one, our Facebook group, things like that, and a few new projects coming up soon. Of course, a lot of our time is working with schools and educators and school nurses. They're one of our biggest audiences. We spend a lot of time in schools, or should I say in Zoom, talking to schools with our free in-service programs, which are really well done and really well received. We've stopped them for the year because it's the end of the year, but when we get back to having school in session for 2022, 2023, we will start booking them. And if you want more information, just email me. And then of course we work with legislators and the boots on the ground state leads. We're not in every state, so we work with state leads, giving them the tools they need to make the legislative process a little bit easier. Because if you've been in it, it's a lot of work, but we provide some of the basic tools that they can use, like a page, so they don't have to build websites and things like that. And then of course, providers and clinicians and researchers, we do a lot of things behind the scenes that we actually don't really talk about a lot, because they just keep coming up, like, can you edit our book, or can you edit this pamphlet for patients, things like that, or can you be the nonprofit that we work with that helps us get this grant, things like that. And we have other different programs. So we've launched webinars. We've divided it into 5 different categories for numerous reasons, but it does allow us to have more than one webinar a month. So we have treatment and scientific updates. We have webinars on behavioral health. Dr. Peggy Chapman, who's a nurse, will be speaking on behavioral health later this month. Dr. Roseann's here talking about neurofeedback. We have a section on school support and a family patient support set of webinars. So today, of course, we have Dr. Roseann Capanna-Hodge coming to speak. She is a certified school psychologist, a licensed professional counselor, a certified integrative medicine mental health provider, and board certified neurofeedback practitioner. She's the founder of the Global Institute of Children's Mental Health and Dr. Roseann LLC. She's on a mission to change the way we view and treat mental health, showing people that it's going to be okay with science-backed tools that calm the brain. With her trademarked Brain Behavior Reset program, she has helped thousands address the most challenging conditions affecting kids and families today, including PANS PANDAS, OCD, anxiety, mood behavior, and ADHD executive functioning. She's always such an engaging speaker and always has so much information. When I've done conferences in person, Roseann gets the after lunch spot because everybody starts to fade off right after lunch, but no one ever gets tired during a Dr. Roseann talk. So She's
well, thank
always
you.
so much fun to have. And
Our last talk we had in 2017, people still come to me today from that talk. It's pretty amazing.
It was a good talk.
So it was a good talk.
It was a fun day. Anyway, so without further ado, Dr. Roseann's going to begin her share. And
yeah. Well, thank you for that lovely introduction. There's a lot of love and respect for you and what you do. And you really do so much for the PANS PANDAS community. And my staff was like, well, she must take a salary. And I'm like, no, she doesn't. So thank you for all that you do, because it makes a huge difference every day in people's lives. So thank you. So I'm going to start from the beginning. We're going to dive into calming the brain of somebody with PANS and PANDAS with neurofeedback. If you have questions, feel free to drop them in the chat. I am going to, if you stay to the end, there's an opportunity for a free gift for you. If you do that, you'll be able to actually ask me some questions as part of that in this something called Video Ask. So this is just my disclaimer. Always ask your provider. That's who you're working with. This is just for information. And as always, in this time from Donald Trump of people being very tense, no judgmental statements are permitted, and always go out of your way to be nice to another parent, especially a PANS parent, PANDAS parent. So for those of you who just came and this is the first time getting to know me, besides me being fun, I'm going to talk to you about being a PANS mom. This is a little bit about me as a professional. This is my 30th year in mental health. I started when I was a baby, and as Gabby gave you some of these, I've done over 10,000 brain maps. I actually have been told that I have the highest the greatest number of EEG brain maps of people with PANS PANDAS and autoimmune encephalopathy. So I don't know if that's true, but that's what I've been told by medical provider. I specialize in PANS PANDAS and OCD, not just in neurofeedback, but actually in therapy. And I am the only provider ever permitted by the International Certifying Board, that's who certifies all people in neurofeedback, to ever do a training on Lyme and PANS and PANDAS. So if you're working with a provider, they probably have taken my training. So I am the trainer of people who do neuro. So that's me as a professional. I'm pretty serious about what I do. I try to bring light into everything what I do, because I am a mom of a child with PANS who my son got bitten by a tick at 22 months. So I have been working with people long before I became a mother with Lyme disease. My first patient I had is in 1997. And part of what I'm doing in this mission, it's not just about PANS and PANDAS. Our mental health system is a dinosaur, an absolute dinosaur. And there is nowhere for our kids in crisis to go. It becomes a hospital. And that is like one of the most frightening places to be when your kid is in a psychiatric crisis, especially when they have PANS, and it's because of a toxin or infection, because people don't know anything. Okay. And I thought in the 90s, we'd learned so much more about tick-borne infection. And I feel like the only reason we've even gotten movement in tick-borne infection is because of the PANS mom. The PANS mom, like our moms with autism, don't mess with them. They know a lot. They're vocal, and they are sharing and pushing this conversation. So a lot of what I do, I'm on TV, I'm always doing social media, I'm doing all kinds of things, is really to change this conversation and really getting people aware. And why I had the privilege, of course, of being asked to do this presentation, a big part of this is that I know today we will make a difference in somebody's life. And it's an amazing thing. The base of my work going forward is to prevent parents from going down this rabbit hole that we've all been through. And that's part of why I made a program and whatnot. So this is what we're going to talk about today. we are really going to dive into neurofeedback and how the heck this calms the brain. And I want you to just get a pen and paper out. As Gabby said, I definitely have been accused of being the Encyclopedia Britannica on mental health. It's the truth. And I know it, and that's okay. But I go through a lot because I want to give, and I want to give that. So we're going to talk about symptoms that affect daily life. We're going to talk about a 5-pronged approach that I am sharing with you today. We're going to talk about barriers to healing. I know exactly why people don't get better. And people come to me from all over the world because they're not getting better, despite going to the best medical providers in the world. And I've got that secret, and we're going to share that today. We're going to talk about stress and how it prevents healing. And we're going to talk about case studies. I'm going to show you some brain maps. It's going to be some cool stuff. So we're going to dive into all those aspects. And for those of you who submitted questions in advance, thank you, because I've incorporated them. So as we already know, if you are a teacher watching today, because I know some teachers are, right, why should this be important to you, right? Of course, we're PANS parents. We think it should be important to everybody, right? But you may have an afflicted child. We just need people to understand how infectious disease and toxins are linked to mental health. And we have to start educating people because people are suffering way too long. This is on the rise. It's so often misdiagnosed. You know, I think if anybody's ever heard me speak, my world record, I am often the 12th or more provider, not unusual for me to be 20th or more provider. My record was I was the 55th provider for somebody. And in 1 hour, we figured out it was tick-borne illness. And that was what it was. That is unacceptable. That is completely unacceptable. A standard diagnosis of Lyme through research says it takes 5 to 7 doctor's visits for a regular, you know, you've got the rash, you've got the fever, okay? Why? Not okay. And PANS and PANDAS is treatable, okay? And that's what we're going to talk about, exactly how to treat it today. So I'm not going into all the details about PANS and PANDAS and AE. These are different disorders with the same symptoms. I'm pretty proud of these slides. I love these slides, just so everybody knows. But you know, this is a situation where the body's attacking itself, right? So PANS and PANDAS, as we know, is a sudden onset. And I'm going to talk about some things that nobody really talks about. So it can be a sudden onset, but it also can be a deep acceleration of a pre-existing condition. Let me say that again. It can be a deep acceleration of a pre-existing condition. This is one of the biggest reasons I see that PANS and PANDAS is missed, because we know that 50% of the US population of children, 10-year-old, 11-year-old data says 1 in 2 children have a physical or mental health problem. So you're likely to have that, right? So they all, whether it's the slow onset, right, a waxing and waning, and there's often some symptoms in there, right? It's really important if you're a newbie to understand that it doesn't have to be the overnight demonic possession that most parents come to me and say, I didn't know what to do, if I should call a priest or if I should call the 911. I mean, if I had $1 for every time. If you know the date it started, it's PANS, right? It wasn't a trauma trigger and you're like, February 12th, 2011, my kid became a different person. It's PANS, people. So we want to look for those common signs. One of the biggest things is tick-borne illness. I started in tick-borne illness and I morphed into PANS because I had to, because it's basically one and the same. But we want to look for those changes. It is not normal to have a sudden change, despite what your psychologist tells you, despite what your pediatrician tells you. My own story was my kid was, you know, in his 2s and he just stopped eating. And the pediatrician told me it was normal. And I said, an Italian child who asked for calamari for breakfast does not just stop eating. And I was like, no, right? So you are the CEO, right? So infectious disease and toxins can exacerbate what's already there. It also can pull out genetic phenotypes. And this is all part of the confusion, because you could have been bitten by a tick or had Epstein-Barr or had COVID, which I'm going to talk about. I have a lot of COVID-induced cases of PANS right now. Everything from brain fog to psychosis I've seen during this time. And, you know, it can come out weeks, months, or years later, particularly with a tic. So it's a lot. And the waxing and waning is really, really confusing. So I'm not going into all the details. Please go to Aspire. They have beautiful information that I know Gabby has really worked hard on. It's like everything in the kitchen sink can be associated with PANS, but what are the most common things? I'm going to dive into that. We're going to talk about OCD. We're going to talk about school refusal, and we're going to talk about behavior, mood, aggression. These are the things that shut down kids, shut down families, and really create these divides, particularly with schools. And I can always tell when a school nurse went to a training, because they ask me the right questions. They don't ask me accusatory questions. And, you know, I've had to defend a lot of my people who are home and, you know, getting calls from Child Protective Services. This is not okay. We should never experience this. We're in a crisis, and then we have a bunch of uneducated people who are not offering help. They're adding, insult to injury, and that's not okay. So I have a lot of food restriction and a lot of eating related issues. I would say the bulk of my cases are OCD related, but at least half of that too is sensory related. And these are just some of those common things. So what does PANS PANDAS look like in real life? What are those behavioral components? And I want to touch on this, and then we'll dive into what neurofeedback looks like. OCD. So I have a huge portion of people who have OCD relate from PANS and PANDAS, okay? And it's because of the inflammation and the infections and triggering epigenetic predispositions, but it's just from inflammation. You know, your brain can't be in an inflamed state. We have all kinds of things. OCD is a tricky beast for many reasons, because they don't understand what it is. And when I mean they, I mean professionals. I was not properly trained in OCD. And I remember the case that I was like, I'm doing a terrible job as a therapist. I had a kid with PANS. I didn't know it was PANS. This was so long ago. He thought he had a hole in his neck. And all he could do was ask us for reassurance about his hole in his neck. And we tried all these things, and he just was so fear eclipsed. He couldn't think straight. And we were almost lucky that he was able to say it out loud, because OCD is about intrusive thoughts. That's where it starts. And there are many times our PANS kids have food restrictions related to it because of, you know, either fear of vomiting, fear of germs, fear of toxins, all different kinds of things. And one of the biggest problems that people have with OCD, doesn't matter if it's PANS or not, is we inadvertently accommodate fears. I'm going to show you that, and we're going to talk about that. And also, I lost an E on there, that many people with PANS don't want to treat the behavioral components of OCD. Your OCD OCD always starts with a worry, and it's how you manage your worry internally. Many of our PANS kids get great medical treatment, and their OCD does not go away. And you keep trying to chase down an infection without doing the gold standard of treatment, which is ERP. This is really, really important. This is a group of people that could be getting better that don't get better. It is why I started doing ERP, because of the boy with the hole in his neck. So OCD is all about fear. There's some type of intrusive, worried thought. It does not make any sense, people. Their brain is hijacked, and it's fear-driven behaviors. And we get into this pattern, and OCD, like, what's the difference between anxiety and OCD? So OCD tends to be irrational. Anxiety tends to be a valid worry. OCD, you're having intrusive thoughts an hour or more a day. There's a lot of features to it. And your OCD can linger long beyond the actual infectious components of PANS. I can't say that enough. These are some of our most common obsessions: contamination, harm, death, scrupulosity, religious worries, right? Unwanted sexual thoughts, perfectionism, like, did I get this right, mom? Compulsions. And, you're going to see things like repetitive questioning. I can't even tell you how many PANS families I have who are stuck in a repetitive question and answer, and they're accommodating them. When it's checking and washing and things, you can see it. It becomes like, you don't have to think, oh, is that OCD? It tells you it's OCD. But that internal obsession component, which is way more common, these are very treatment resistant because we're not always aware, and kids can hold it in, right? Like if you have an internalizer PANS kid, which depending on if they're in a flare or not, or how it presents itself, this could be them. So this is where ERP comes in, and what does it do? And I'm going to explain what it is. But antibiotics and medical treatment alone often can't squash OCD. Okay, let me just say that because that's the truth. And there's a whole neuroscience. I'm going to show you what it is. It's called a negative reinforcement cycle, and the behaviors get stuck. And you're going to see why it's reinforced. So we have to behaviorally dismantle the OCD, okay? And that's through safe exposures. What is ERP? It's exposure and response prevention. It's not cognitive behavioral therapy on its own. It's a waste of your time, people. If you're going to an anxiety therapist, you might as well just throw your money out in the street. Okay, because it's actually going to reinforce their OCD when I show you what happens. And you need to use somebody who does ERP. It is what it is. You're going to have to find somebody, right? Like whether it's me or you go to nocd.org. That's, some people are getting good results because they're training people, but it's treatable and can be extinguished. And how ERP works, just from logistics and why it's so different, is you identify the obsessions and compulsions. It's done in a very strategic manner. And then the child and the parents are exposed to that fear, not the top fears, but like a low mid one, right? It depends. You need a really skilled therapist, okay? You're asking people to face their fears. You're asking somebody. It's like my friend Carrie, we were in Hawaii and they were cliff jumping, and she came up to me and she's like, you should do cliff jumping. It would be really good for you. And I was like, Carrie, I ain't doing no cliff jumping. Right. But it was like Carrie being on the top of that thing that was important to her. It was not important to me. I'm like, where's the, where can I get a margarita and let's get some music going? That's what I'm going to be doing. That's my priority. But that fear, right? She talks about facing her fear. Well, that was a choice. Oh, OCD isn't a choice, but we have to teach the brain and extinguish it. So not all OCD therapy is the same. And what I talk about is calming the brain. And that's where we pair it with neurofeedback and PMF. We'll talk more about that. But what happens in a negative reinforcement cycle is you have this worry. You have this obsession, this compulsive, these intrusive thoughts is what people talk about. And let me tell you, the worst thing about therapy in a non-OCD trained therapist is they talk about feelings. You talk to a kid with OCD, they're like, this is like they're talking Chinese to me. They're having intrusive thoughts, okay? They're having discomfort in their body and body sensation and intrusive thoughts. The feelings is the last thing they care about. It offers no value to them. When they're like, how do you feel about your OCD? It sucks, is usually what they say to me. They don't say, oh, I feel like whatever. It's not, you have to get into the cognitive portions of it. So what happens is, and I'm going to show this to you, I'm so excited about this, is we're going to break this apart, right? So number one, the purple is when we accommodate, I'm going to go back, we're going to go here. We accommodate OCD, right? So I always use the same example. It's a true story. I had a kid that got a splinter, really bad splinter, and I now know it was PANS. It was like overnight, he turned into a different person. And what he would say is there going to be splinters when we go to the park? And what did his parents say? Anybody? No, there's not going to be splinters. So we're going to call him Joey. Joey would initially get worried, and then it would lower when his parents said, it's going to be okay. Don't worry about it. But over time, his OCD got worse. Okay. And this is what we teach in ERP. I hope this is really helpful for people. Feel free to drop it in the chat. But when we do safe exposures in ERP, and I go, Joey says, Mommy, is there going to be splinters at the park? His anxiety goes through the roof the first time. Okay. And maybe the first 10 days, because that's the way it works. But then you say, I don't know the answer to that, Joey. There might be. And he's like, oh, and he learns to get uncomfortable. Or you say something like, we train you, you say, you got through it yesterday. What did you have to do? And over time, it extinguishes people. You don't have to live with OCD. You do not, despite what good pharma has, pharma has taught you. So I hope that makes sense for people. And ERP is about this negative reinforcement cycle, is that when we accommodate, we make it worse over time when we don't accommodate. And the therapy is about the behavioral dismantling. And the neurology behind it is a negative reinforcement cycle in the brain. We actually reinforce the behavior to happen more. And don't get me wrong, I'm a PANS mom. I've had the OCD, I've had the psychosis, I've had the phone in my hand. Should I call the priest? Should I call 911? I've had it all, people. So I've been there and I've supported, I don't know how many people with PANS, okay? At least in Lyme, at least a few thousand. And so, and it's about understanding where somebody's at, and it's not always easy in that moment, but we can't accommodate it because all you do is feed the barking dog. And when you feed the barking dog, it gets worse. Okay. So that's why the behavioral part is really, 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 really important. Okay. So a big pain point, and I can't go into every behavior. I'm a behaviorist and a detective, and all these things are important, but I want to talk about school refusal because this is a scary, scary thing. And another point that schools are so overwhelmed with school refusal. They have no flipping idea on how to manage this right now. This has really become a crisis that's not related to PANS. It's related to kids' mental health. And what I always say, here's the deal about school. Healing has its own timeline. People come into me and they're like, how quick are we going to get better? Where's my magic wand? It's on my desk, people. We don't know what healing looks like, but what we can use is the science of healing to hack in and make it better and make it more efficient. And it requires a lot of work and commitment. And it's not going to happen with one antibiotic and PANS and all that stuff. I mean, I've been treating my now 17-year-old for a million years. We went to Dr. Jones, he didn't even tell me about anything else besides antibiotics. And I remember we did craniosacral and he was like, oh, about 50% of people get better. And I thought, why didn't you tell me? Why did I have to find out my own? Like the integrative piece, it just isn't always in people's front of mind, but there are a lot of things. So we have to address underlying issues. We have to prioritize the physical and the mental health. You want to get everybody together. You want to have a school meeting. You want to provide documentation. And you want to have a school support plan. And you want to think outside of, I've got to have my number one priority of my kid getting back to school. I could tell you story after story after story. I have kids that hold it together with PANS at school and then are literally running down the street naked at home, trying to knife people. You name it, that can't be a priority, people. Your grades are not a benchmark of mental health. And if they have to delay going to college or their next stage of their life for a year or two so they can really lick this and get better, that's okay, right? So, my teenager is homeschooled. That's our choice. We've done all variations of school. I'm going to tell you, like, reducing stress, we're going to talk about that, made the difference. But we need a proactive plan for flares. I know anybody who comes to me, I have a flare care plan. You leave with a plan to prevent flares from happening. But you need a step-by-step plan. You don't just get better and then show up at school on Monday and do a full week. Okay. You really got to step them in. There's a lot of pieces to this. And I'm not saying don't send your kids to school. I'm saying if your kid isn't getting better, take an analytical mind, look at what the biggest stressors are, and school might have to come off the table. It's just what it is. If your kid had cancer, we wouldn't have this conversation. But because it's somehow related to mental health, we think it's optional. And if you don't have mental health, as we're all painfully aware, it doesn't matter anything in your life. It doesn't matter what kind of car you have or where you live. It doesn't matter nothing. So this is a disorder that hijacks lives. And but we can battle it, right? So why are these infections so treatment resistant? I thought I had a whole thing about behavior in here. It's not in here. Oh, it must have got deleted. I had a whole thing about just rage and behaviors, and it's gone. But I don't want to dismiss rage and behaviors because they are scary. And when your kid is an externalizer versus an internalizer, you're going to have a different set of problems. Beyond age probably 9, 10, there's zero tolerance for behaviors anymore. And people get very, very scared of aggressive behaviors. I mean, they're scary. I've had a kid be aggressive, right? It's frightening. It's scary. We are not going to punish kids for those behaviors. We are going to try to love them up more. And we're going to try to give their brains and bodies more ways to relax, meet sensory needs, calm it the heck down. That's what this neurofeedback's about. That's what PMF's about. So I don't want to exclude that because I feel like these are the 3 biggest challenges people are facing. I'm not saying ADD isn't a challenge and the loss of skills and all that other stuff. These are the crisis things that come to the table. So why are these infections so treatment resistant, right? I've spent, 20 something years since 25 years since 1997 trying to figure it out, right? And that's what psychoimmunology is about. What does the science tell us about healing? It's there. It's why do we ignore it? So healing can only occur with a calm brain. Okay. Your body will not allow you to heal itself if it is not regulated. It's not. It could try to heal itself, but it's not going to do it at an optimal level. And I talk about people come to me at all different stages, right in the beginning, in a full-on crisis right out of the hospital. Before they go to the hospital, they come to me at 60%, 70%, 80%. I have people who come to me at 90 to 95%. God bless them. So it's about the effect of stress on the body. And I have all kinds of slides on it. I'm not going to go into every detail, but what you do need to understand is what happens. Once you start a stress trigger, the brain and body's resources go elsewhere. So a stressor happens, we have a normal stress system. And once you become in a sympathetic dominant rev state, your hormones, your cells, every single thing, your neurotransmitters will go to try to figure out what this unknown stressor is, and it will ignore a known antigen. I hope this is an aha moment, because the chronic rev state, which can happen, so it is part of PANS. There's not a mother that's not in this state, right? Then you are not capable of healing in the same way. So, your cortisol level goes through the roof, your neurotransmitters, you're actually getting changes in the brain, there's cellular changes. Every resource that you could to handle stress, your gut, your heart, everything moves, right? And your heart has its own ecosystem, like your gut has its own ecosystem, and these all work together. There is nothing more damaging in the world today. And I feel like America in the greater tri-state area is sort of like ground zero for chronic stress, right? And you have cognitive, you have emotional, you have dysregulation of behavior, of thoughts, of physical symptoms, you name it, they're all there, right? So stress and being in a rev state, it's not everyday stress. it's being stuck in a sympathetic dominant is one of the top reasons why you can't get better. Detoxification, improper detoxification is the second. We're going to review some of these at the end. So how do you treat it, right? So, I start with, we got to know the clinical criteria. You got to look at the history. You got to get a great, if you can, get lab work. There's no definitive lab work, people. Let's just say this is a clinical diagnosis. I feel so bad for people who get all this really expensive medical lab work and they are told their kid doesn't have PANS, right? Because whatever, some criteria which doesn't exist isn't there. So think about it. I have a checklist that I have developed for providers. Gabby probably doesn't even know this. And I want to talk about, we have a 3-pronged approach, but today I'm going to talk, there's There's my other slide about mood. But we're going to talk about, I forgot to talk, you had a lot of questions about Bartonella. We'll talk about it at the end, psychosis and whatnot. I'm talking about a 5-pronged approach, okay? And this is what I do, okay? And that is, we have antimicrobial treatment and toxin treatment. We have immune treatment, right? And those are important. We can't negate these things when there's toxins, but we have to also talk about detoxification, right? So we can kill the bacteria, the viruses, but if you're not detoxifying, nothing's getting better. Okay, it's just going to flood back in the system. It's truly a stopper of healing, right? And it interferes with the gut. I mean, the gut should have its own component on here, but the gut is filtered into everything. We have to calm that brain, right? So I use lifestyle tools. I don't just use neurofeedback and biofeedback. They're my favorite. PMF, I'm a big favorite of that. I love meditation. Let me get a ragey PANS kid to meditate, or a mother who's jacked up. Not going to happen, right? So I try to use these passive tools like neurofeedback and PMF because you don't even have to believe in them or like them. I've had kids in full-on crisis that the only time they're calm is when they're sleeping, and we're doing PMF on them when they're sleeping, right? I've developed an overnight protocol that's exclusive to me. That's an 8-hour protocol to help kids get better. So, and we have to calm that brain. There are multiple ways to do it. There are DIY ways to do it. There are clinical ways to do it. You got to counter it, and it's got to be all the time. It can't just be the neurofeedback twice a week or 3 times a week. It's got to be a lifestyle. We have to do that. And we have to address the psychotherapy component of this. We need behavioral help. We need education for moms, dads, grandparents, those annoying family members who don't understand your kid isn't doing this on purpose. No kid ever does anything on purpose. I have had such a joy of watching Prince Louis this past week at the Jubilee, and I'm going to make some cute little gifs about it because, he had to sit as a 4-year-old through his grandmother's big event, and he was making all these faces if you somehow missed this. And I thought, how awesome, this normal developmental behavior. And his mother, he's a third, she didn't seem too affected by it. But people think our kids are doing this on purpose. I mean, how sad is that? Who wants to think there's a freaking hole in their neck? No, it doesn't happen, people. Who thinks that their kid really doesn't want to go to school? If they're bullied, yes, I understand, right? But this is not what our kids want, and they need love, they need support, and our parents need love and support, and they need real flipping tools on how to manage these behaviors. These can be very frightening. I can tell you when my kid has been in a flare, my husband and we talked about openly, we were tag teaming it, right? Because, this is either going to make your marriage or it's going to break your marriage. It made the Hodge marriage. And I would be like, tag team, you're it. And he would go in and, sometimes it was rough. We were able to get out of the flare patterning based on what we do. We have a flare kit. But the behavior part can't be ignored, people. I know this is overwhelming. I know that there's a lot going on, but this is what needs to happen synergistically. And the worst, and this is why I moved from doing a la carte services to a program where I kick you out. when you don't do the program, because I know that I'm not helping you and I don't want to waste your time. Because you need wraparound care. You need wraparound support. You need to understand why this is happening. And then you need resources on how to actually do it. Resources that make sense. I think behavioral change freaks people out, but you can bring things in slowly. But if your kid is in crisis, you don't have a choice. You have to do it, right? But let's break this up and down flare model and let's make it better. Right. So integrative, why I love integrative is it takes a multi-pronged approach. I use a clinical intake to guide all my treatment. It involves Q. Sometimes I get functional lab work. Sometimes I don't. I do like lab work. Most of these kids have deficiencies at a minimum. There's going to be infections. There's going to be something in there, but you're able to see what's robbing the body. Is it zinc? Is it vitamin D? You know, when certain infections pull nutrients, we have to replace them. And there's a lot of different integrative treatments. Here's what I say about integrative treatments. If it's helping you, amen, people, do it, okay? But I do think we need to be strategic. And we have to really, really look at what is calming the brain. You know, we did Reiki for reflexology for 18 months. It was one of the most transformative things that helped my kid, you know, and it helped my hormones at this, because we went together, you know, so everyone has something that works for them. I'm just trying to share and try to save. So these are some of my favorite tools. I know we can't do breath work and meditation. We can do breath work, very, very small amounts, even in high distress. But what I'm trying to do is get people off of this and start smoothing it out. Remember, the brain is fear hijacked. When the brain is in that state, you're only in fight, flight, or freeze. You're not capable of thinking. So these are things that I use every day. And this is the bulk of what I use: neurofeedback, biofeedback, PMF, behavioral therapy, psychotherapy, and coaching. And we do coaching because people come to us from all over the world. I'm going to spend the rest of this time really diving into neurofeedback, and I'm going to wrap it up. But remember, when you're in a rev state, your nervous system can either under respond, like ADD and being unfocused, learning and processing problems, or over respond, aggression. When I look at these brain maps, you'll see some of these brain maps, they're on fire sometimes, especially in the highly infectious inflammation component. A long-term case of PANS where you're sort of in this kind of up and down flare, but not necessarily crisis flare, looks different. So how does neurofeedback help? The bottom line is it takes you out of that sympathetic dominant state, that fight, flight, or freeze. It takes you out of it, right? Somebody shared with me today, they were too distressed to do neurofeedback. So I made a plan for them. We do pre-plans to get people ready if they're not ready. And sometimes they don't even need to do neurofeedback. So she came in February and she said almost instantaneously his sleep improved. And he's reduced his tics by 80% and his anxiety has gone down, she said, about 50%. And she was like, can we start neurofeedback? And I was like, okay, let's do a brain map, because maybe we don't even need to, but I gotta reconnect with her. But you can't think fight, flight, or freeze. I mean, who hasn't, as a mother or father, been here who's not been in fight, flight, or freeze when your kid is freaking out? I have been. It's a scary place to be. And our kids are living in there. They're just always just above it. Right? So the body's resources can't help you. So what neurofeedback is going to do is take your nervous system down into regulated state. It's going to create wiggle room so that the resources that I like to create is a visual that's sort of like these encampments of soldiers sitting around like, where's the stressor? What's going on? They're like, oh, we can go back to our barracks. And, we can do the non-war things, like we can, clean the equipment, we can get everything working. That's what happens. That's why it unlocks the healing. So, and only when the brain is calm, this is psychoimmunology, right? There's all this research about it. This isn't just Dr. Roseann. So neurofeedback, it helps you to be go from focused to unfocused to focused. It's safe, it's natural. It produces lasting change. There's research as far as 10 years out. I love to actually, sometimes every once in a while, somebody comes back. There's tens of thousands of research studies, 3,000 peer reviewed, and research for ADHD says that you can expect a 91% improvement. There is not any research with PANS PANDAS specifically. I was organizing research right before the pandemic. Obviously that didn't happen. So, it's on my to-do list to at least write up my case studies because my colleagues recognize that I'm the leader doing this and they really want me to. So it's on my list. So we're going to talk about how neurofeedback works because I'm talking about it and you're like, what is it? Explain it. So it's based on operant conditioning, right? And it's really simplistic. So don't overthink it. That's what most people do with neurofeedback. The brain gets reinforced when it produces a healthy combination of brain waves, okay? And how does this all work? I'm going to show you, but the subconscious brain is in control. And the subconscious brain is controlling our brain waves. And when I design a protocol, whether somebody comes for QEEG or brain check, I'll explain that. I have this protocol in 2 to 3 seconds from the first time you're hooked up, the brain will produce the exact perfect healthy combination of brain waves. It just can't stay there. It has to be reinforced, just like working out, right? I've started getting up at between 4 and 5 a.m. to work out. I mean, I want to poke my eyes out, but I'm super happy that I am. It's the reinforcement. I just roll out of bed. I just work out, go downstairs and I work out. And guess what's happening? I'm building a muscle, I'm losing weight, getting positive reinforcement because people are like, what have you been doing? You know, but it's using sensors and we'll show you some pictures and nothing comes through the wires, at least EEG neurofeedback, the kind that I do. There's no bad neurofeedback. Okay, people, there's only bad practitioners. So neurofeedback, the success of neurofeedback, honestly, is very much determined by the experience of your practitioner, because all the equipment, as much as they love to do all this talk about their equipment, it's not the equipment. There are definitely better kinds. I use EEG because I have done all kinds of neurofeedback in these bazillion years. And I have found my population, whether you have PANS or not, or except you have PANS, is that the brain is very dysregulated. And this is the most effective and conservative for my population. Doing lens, which is low frequency, doesn't seem to hold. Using CAP training, Z-score training, almost certainly destabilizes my people. And so this is what I know to work. And this is what has consistently gotten me results. And again, I've treated thousands of people doing this and I'm training other people on just how to do this. And the number one thing when other providers come to me is, I made it worse. What am I doing? That is the number one reason why providers come to me. They have no idea. They've never seen this brain. They don't know what it is. They don't understand what it looks like on a brain map. They don't understand, right? So I am changing that conversation. It's just pretty cool. So, but neurofeedback is going to take your overstimulated brain and it's going to make it regulated and calm, just like the nervous system. So if you have too many overactive brain waves in the frontal lobes, which is making it hard for your kid to not tell you to F off, it's going to calm it down, okay? So we're gonna see differences in the amount of aggressive speak, right? If your kid is like, can't hear you when you call their name, it's gonna make it where they can hear your name more likely, or you don't have to say it as much, right? We start getting those early changes, but through the computer, the brain is going to get reinforced every time, right, that it does it. It's attached via sensors. Nothing's coming through the wire. I say it twice because people ask me the same question. So this is somebody getting hooked up, and this is actually our home equipment that we mail to people. And we see people in person, and sometimes my PANS people love to fly out, get a brain map and leave. Not everybody can do that. And so we use something called a brain check, where I do the intake first. I determine you are a good fit for us. We're in alignment. And what does that mean? It means you're willing to do the work and you're going to be nice to the staff. So if you're rude, we don't accept you. Imagine that. And no problem is a concern. No child's problem is as a worry to me. If I believe I can help you, I will help you. I'm not afraid. That's another part of mental health. Our providers don't want to work with kids that are aggressive, that are, can be scary in their behavior. That doesn't affect me at all. What I look for is people are all in, like, not like, yeah, I didn't decide to take that B12, Roseann. I didn't think it was important. You have to listen to your provider's recommendations, whether it's me or somebody else. You have to have honor and have fidelity, right? We can't say something didn't work. You'll see chatter about neurofeedback not working. It's often because the person left. If you're doing less than 20 sessions, waste of your time. We'll get into that. So the neurofeedback process for most people, but this is what I do, is you're getting a brain map. Not every provider knows how to do a brain map. And probably less than 2% of providers interpret their own brain maps. Of course, I interpret my own brain maps. And that's because they just don't understand it and they send it to a service. That's okay, people. That's all right. And people wanted to know, should you check for seizures in advance? If you think your kid is having a seizure, you should go to a neurologist. This is an EEG, so it's going to measure activity. Your likelihood that your kid is going to have a seizure, or yourself, during that 20-minute process of a brain map, that's a brain map right there, and is very unlikely. It has definitely happened to me with all ages. It's really interesting how that happens. You can have pre-seizure activity. So then I do an intake, and I don't do any consults, people. I'm just going to say that. So I don't consult for anybody because I need to devote my time. I've changed what I'm doing so I can devote my time to my people. And then people are assigned somebody. They're working with somebody directly. They're getting 2 to 4 sessions in 30 minutes. Their sessions are 30 minutes. I often do intensives where people come and they do 5 or 10 days intense. Why do I do an intensive? It's a total crisis. It's either avoiding a hospitalization or after a hospitalization, or they just really want to get serious about it. And an intensive can be really amazing because you force the nervous system to regulate. And we wind up doing about 5 hours of different types of therapies a day for our minimum of 5 days in a row. It can be pretty transformative. Not every person can do that. And that the cue will determine if you're a good candidate. Like sometimes my peeps want to do it when their kid is in like a full on flare. Might not be appropriate, often isn't. And so then I work on an alternative treatment plan. And then we really focus on lifestyle. I call it brain keys, but what can I bring that's scientific, that's going to hack into the nervous system and calm it down? And then I make a flare care plan. So this is kind of what it looks like to be visual. You get a PEG for most providers. Some people don't do anything. A brain check is statistically looking at certain areas. Your provider should at least be measuring and doing comparative analysis of what they think. So where they think. So let me give you an example of that. So I talked about, what if we had a really impulsive kid? Where are we going to look? It's the frontal lobes. So we know exactly what the brain does. And that's why neurofeedback is so effective, because we can train those areas to work better. So your occipital region isn't going to control your impulses. So why are we training in there? But we would want to check those areas. We're looking for, with PANS, we're looking for inflammation, right? We're also looking for, which most people are not thinking about, I get as many people with inflammation as I get areas, long-term chronic infection cases, particularly viral. I'm going to show you an example. The areas are off. They're not working. Inflammation isn't the problem anymore. There's just very poor activity due to these infections coming in and shutting things off. COVID and Epstein-Barr shut everything off. And anybody who's had the chronic, you know, post brain fog knows exactly what I'm talking about, right? So like I had it for like 3 weeks. I went in the sauna and I did whatever. I got people that have it for 20 years, you know, from Epstein-Barr or whatever. Then your provider, we call it a care plan, should be making a treatment plan for you, right? Mine's very comprehensive. I do supplements, I do all kinds of things, therapy, whatever. And then if you're coming in person, you're not learning your equipment, but you should have a session. You should be able to learn how to use your equipment. If you're remote, you do sessions 2 to 4 times a week, 30 minutes a day. If you're doing less than twice a week, you're wasting your time. If you're doing less than 20 sessions, you're wasting your time. Don't bother. Most people are doing at least 40 sessions. It really depends. So if I can get people to do the lifestyle components, it's not always possible. I'm not going to get people to try to change their diet if they have OCD around food. You can't. And this is where the experience of a PANS person comes in. It's the right treatment in the right order at the right time. So you can't just be like, you know, I get parents that come in and like, I feel so bad. We should be doing an anti-inflammatory diet. I'm like, hold on. Okay. Everybody should be doing an anti-inflammatory diet. It fights the aging brain. What is like your kid literally is fear hijacked and will not get out of their bed and is urinating in their bed. That's real. Okay. So what are we going to do? Right. So that, you know, the priority has to be calming that nervous system, and the behavioral part of conquering the OCD about getting out of that bed. That's the real world. Then we calm things down. I like to do phase 2 in my wellness coaching. I put it towards the middle, and then we do data collection. We continue neurofeedback. I like to do more than 1 Q. I typically do 3. I love to add food in there, right? That's my little guy. He's like the world's biggest foodie. And then we keep making lifestyle changes. When you have a system that has been freaking run over by infectious disease, I work with people all the time, people that get better and stay better. The key is they are adding in lifestyle components, right? What are those lifestyle components? It is food. It's staying away from jerks in your life, right? It's protecting your energy. It's not getting into arguments with people about your kid has PANS, like another parent, you know, you drop the info and you leave, you know, it's really protecting yourself and making better lifestyle choices for yourself. That's not a bad thing, people. That's what protects you in life. So that's what it is. So what does neurofeedback address? There's a lot of research. There literally is tens of thousands of research studies, 3,000 peer-reviewed, but there's also a lot of studies that are single case studies, and that's okay too. I don't know if there's anything I haven't treated, to be honest, with neurofeedback. Like I've treated seizures, I've treated strokes, I've treated mood, anger, OCD, I mean, just straight dyslexia. Lots of head injury. I have a lot of clients who had a head injury and then boom, get PANS. So, you got to figure out what it is. Do a lot of eating disorder, tics. I mean, there's just a lot of research. I would say there's probably nothing. There's only been one client ever that I said, I absolutely don't think I can help you. And they had cluster headaches. Cluster headaches are its own beast, but a lot of times I'm like, listen, you know, we're never going to say it's a cure. We're going to regulate the brain. The brain is very capable of getting regulated. And in the case of PANS, you are regulating it so that the body can heal itself. Okay. Without that calm brain, it's stuck in a rev state, right? So these are based on some of your questions, and I'll look at some of your questions in advance. So a lot of your questions, and there's a lot of misinformation about neurofeedback, right? So, and when should you do it is probably one of the biggest things, right? So sometimes people come to me and they do a consult and they're like, well, we decided to do this, this, and this, and then we're here, you know? I recently had somebody that's been following me for 8 years. And why are they here? Crisis. You know, and they were like, we're done, you know? So we've gotten further in 2 or 3 months than they have in 8 years, right? They're committed, they're all in, right? Like it's not easy, right? And so It can be in the early onset. It can be in a rage flare. It can be post-treatment. And I get a lot of people that are just not returning to normal, but they're not rage, they're not OCD, they're not in a crisis, but they recognize that their child or themselves is different and they want to restore. It is so unique to each person. I wish I could say to you, absolutely. And a lot of it has to do with the experience of your provider, because neuro at this phase, when you're doing this and you're in early IVIG, might not be the best choice. Like, and so it has a lot to do with the right treatment, the right time, the right order, right? But it doesn't matter. You had all kinds of questions about Bartonella. I mean, who doesn't have Bartonella in PANS, basically? You know, I'm not saying that, but there's so many infections. I don't think you know, when new tick-borne infections come in, I have it. But it doesn't matter what the toxins are. It doesn't matter if it's mold, even though I do feel like mold is one of the most poorly rectified issues. There's very few people. I know that's one of the things that I have undertaken to learn more about, even though I feel like I know about a lot about it. It seems to be a staller in treatment. And so when I have people who have mold, I'm like, oh, wait a second, what's the mold plan and who am I going to connect you with in that? So it doesn't matter what the triggers are. It doesn't matter what the toxins are. A lot of providers will tell you not to do it in an active flare because they don't know how to manage it. They don't know how to manage the behaviors, and they don't know how to do neurofeedback with somebody who's active. So that's where that comes from. But you have to have an experienced provider. You have to have data. You need either a QEEG brain map, you need a brain check. You shouldn't just be doing this without really knowing what the points are. You have to have an ability, and that's a big word, willingness and commitment to do sessions at least 2 to 3 times a week. Okay. And you got to look at what are people's current medical treatments. It's a factor. Willingness, what's your detox plan? You better all have a detox plan. And it's not like your naturopath going, oh, take all these things all at once. Like, it better be thought out. We know exactly how the body detoxifies. You have to have a willingness to do behavioral work. And I know you're freaking exhausted. Okay. But it's about shifting what you're doing to working smarter, not harder. And I think that's one of the biggest mistakes people make, is just like you accommodated the OCD. I've had people say to me, I cannot do this. So 30% of people drop out of ERP because of the uncomfortableness, and it's the parents. It's not the kids. Nobody wants to give up their intrusion. So what do you have? We got to think about the school plan, what's going to happen. Some people want me to work miracles and then keep their kid in school. And some kids can stay in school, but if they're in a full crisis, we got to put life on pause. Just like I said, if we had cancer treatment, we wouldn't even think of not putting life on pause. Why are we doing that for mental health? So if you're too agitated and unable to do treatment, which sometimes happens to me, I told you the case of a young man, then we do a pre-neurofeedback program. And I'm a huge fan of PMF and BRT, which is a very specific type of device that I have proprietary protocols that I've developed. And it's a small mobile port. I could do a whole other training on that. I love PMF. But I'm able to directly target, because it works at a micro level, exactly what's going on. And I have PANS protocols, I have OCD protocols, I have all kinds of things that I've developed over the years. So we have to calm the brain down. Whatever I got to do to calm that nervous system and brain down without including toxins. I didn't really talk about medication. Please never think I judge another mother. I would never judge another parent. We do know through 2021 research, January 2021, that most people have adverse reactions and they are not tolerating the dosage appropriately. I'm going to tell you anecdotally, I rarely see it work because of the toxic load. And also we're trying to address neurotransmitters when the underlying problem is an infection. So with that being said, this is something that works. for a lot of the people. So here are some of the questions that you had. And does your equipment matter? Yes and no. Your experience of the practitioner is the most important thing. I am not a fan of Z-score cap training. It's too aggressive. But absolutely anybody in an active flare state, the answer is heck no. Okay. I don't like lens. I think it's okay if you have stress or anxiety. This is PANS. Okay. We're going to make the investment of time and money. Let's do what works. Right. So I like EEG. That is what I like. I also, you heard me say, I love PMF. I don't think I have anybody with PANS who isn't doing PMF. Who should you go to? You can go to bcia.org and you can find a provider. Yes, you should get a brain map if you can. At least get the first one. And you know, when do you start? I don't know the answer to you for you in that. There's all those factors are a part. You start when you actually can commit to it and you can see it through, whether that has to do with time, finances, your child's ability to sit. Those are the things you have to make a commitment. And then what do I do when a kid doesn't comply with treatment? I'm going to tell you, when I have kids who are ready for neurofeedback, I've had 2 kids ever refuse to go, ever. And it was behavioral. They were like using it as a control mechanism. It feels awesome. I mean, I've done hundreds of sessions of neurofeedback. It's a great treatment. If your kid can't comply, again, we have to find another way to calm the brain to prepare them. I do think it's great. And sometimes people do PMF with me and they don't even need neurofeedback. And sometimes I just get right into neurofeedback. It really is unique. I wish I could give you, people ask me this a lot. Should I do neurofeedback concurrently with other treatments? It can be a beautiful amplifier of your medical treatment, of your holistic treatments, your herbal treatments, your cranial sacral, whatever. It can be beautiful because with a calm nervous system, those other things work better. It's pretty awesome. How quickly does it work? Everyone is different. So most people, when they do neurofeedback, what happens is, I always give this visual. I need this graph. You're gradually changing, right? So here's your homeostasis, full on OCD, dysregulated, fear hijack. This is your set point. This is what we're working on. I want to change your homeostasis, but I want to get you here. Okay. So when you do neurofeedback, it's learned. Nothing's coming through the wire. So what you are moving towards this, and your brain does not want to stay there. Okay. Just like when you're trying to lose that weight. Okay. And once it changes its set point, you really start to see a difference in intensity, frequency, and duration of behaviors. Do I ever have people? So everyone's a little different. You don't know where that's going to show up. So that OCD, I'm looking for the OCD is less common, right? I had somebody who came to me, and please know whenever I talk about cases, I mix them up so they're not identifiable, but I had somebody who came to me that was vocalizing loud. And actually the school was like, they're going to have to be home. Okay. It wasn't a tic. It was OCD ritual. And so they came here, and almost within 2 or 3 weeks, it completely stopped. All the other behaviors were still there around OCD, but the crisis one had completely stopped. You don't know. I was really focusing on calming his brain down first. And neurofeedback works on specific brain structures and how the brain communicates. They are equally important. Not one is better than the other. And with PANS, the number one mistake a provider makes is they go into the hornet's nest. They go into the worst area of the brain and try to fix it. And that is the worst thing you do with PANS as a neurofeedback provider, because it can flare behaviors. So can neurofeedback hurt somebody? Temporarily, in the case of an untrained provider. It will be temporary. And for people with PANS and autism, you really got to know what you're doing. The autism brain is very unique and is prone to overtraining. And an inexperienced autism provider could cause some lingering, some short-term difficulties that could destabilize. You want to be careful. A lot of people come to me after going to another provider, and I always think that is so amazing, because you're willing to, you have somehow have faith in this. And usually it's because they have a friend. And it's because that they had somebody who just didn't know what they were doing and overactivated them or destabilized them. So how quickly does it work is unique. Most people, it's gradual. On a rare occasion, particularly with birth trauma and concussion, it can be nothing, 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 light switch, overnight dramatic change. No guarantee. Most people really get some improvement. So you tried neurofeedback, but are they still a good candidate? I don't know the answer to that, but it's probably you'd have to look at everything. There probably wasn't the right treatment at the right time. It was probably inexperienced provider. You'd have to know that. And what's the best neurofeedback pace? Like, most people with PANS can't tolerate intense. Some of my people can when they're like the post-treatment, but just not back to normal. Sometimes they can handle the intense, especially when I show you some of these brains. And what does the research say? So we know with all of those related conditions like rage and anger, there's a lot of positive research to show that it's an efficacious, safe treatment. You're not going to harm your kid. And it's really about calming the brain. So you have an inflamed brain, you got to calm it down. And when a brain is calm, it starts that central nervous system, inflammation goes down, the microbiome starts to work properly, everything happens. But this is when you're able to learn new skills. And when a kid has been impacted for a long time, even my own kid, right? I mean, we're the Hodges. We've like the best house. We have the best pool. We like love our kids to death. We are so committed to our kids, right? It takes time to unlearn these behaviors these kids had to adapt to really almost survive mentally. This is a horrible, horrible disorder. It comes with a lot of shame. There's a lot of things, and it's taken time, and we are on the other side of it. It's pretty amazing. So, but you have to make an investment to calm the brain and learn new skills. There's no shortcut around that. It's just the reality of what it is. Here's some case studies, and I just want you to see. So this is somebody with active Lyme. Okay, so they're having a flare. They're diagnosed with PANS. They had previously been diagnosed like years ago, years before they came to me, when they were doing IVIG one time. And they had gone and gotten IVIG one time. And I was like, who does that? Like, it was like, it was a different time. So they were experimenting it. So he was in an active state and had regressed behaviorally. And the red in these lower frequencies represent a whole lot of inflammation. So what we did is I got him back into medical care. He got, I'm sure it was antibiotics at the time. It was a very long time ago. He got, antibiotics at the time, and we did neurofeedback. He went from being this ragey kid at school where they thought they were going to kick him out in the little private school to actually overly lovey, and we had to kind of dial it back. But I think he was just so happy and relieved that he wasn't so aggressive. But that's what inflammation, it looks like overactivity in the lower frequencies, particularly delta, theta, and alpha. And beta overactivity there is representing irritation and anger and anxiety. He had a lot going on. He was able to resolve it pretty quickly. And his mom, of course, the sister had Lyme, and so did the mom. So they all got treatment and got better and did things at the same time, which is a curse and a blessing at the same time. This is somebody who had a lot of infections. Like, I don't know what wasn't there, and mold, and had a lot of overactivity in beta. So there was rage, there was total mood lability. Like, he was, they were up and down, right? And that beta is a focused brainwave. And when it's over focused, it's always going to come with some level of anxiety, irritation, and, sort of like the walking on the eggshell kind of person. And this was a girl, and this was them after after we were able to almost fully normalize our brain functioning. And you don't have to have a perfect brain when you leave, by the way. We look for the changes in the quality of life. And we do behavioral measurements. I don't just do these brain maps. I want to see, I have a number 4, scale 0 to 10. You got to be in a 4 or under in the key areas, right? You can't have perfection. Like sometimes we put on there like, won't hit sister. Well, that's a miracle, people, you know, like, but we can reduce it, you know, I mean, I joke, but these are real life problems. This is a COVID brain. So this was a very interesting case, 100% normal teenage boy, 100% normal. I could not find anything in his history, right? And I was like, who has a normal history, you know? They got COVID. Within a month, they got diabetes. And then they started getting OCD, and then, you know, anxiety, OCD, and then depression. And this was in that period where people were not making the connection between COVID and diabetes 1. And we did neurofeedback. We almost fully normalized. You can see some inflammation in here. Now he's a diabetic, but we did ERP with him. We couldn't touch any dietary things at first. There was a lot of food restricting. There was some fear around germs in his food, but we were able in the next phase to work on that, right? So it's all about the right phase. We can't punish ourselves if we can't you can't always jump into the deep end, people. Sometimes we got to like walk really slow into the pool, right? So what are some barriers for treatment, right? Obviously finding the providers, the brain not being calm, the right treatment, identifying what the heck those toxins are and infections. I can tell you my own story is like, my kid was doing fabulous. It was like year 9 and all the infections showed up. And Dr. Jones like kept telling me, oh, this is indeterminate. You know, this will change. And I didn't understand, but what he meant is it's indeterminate. It's going to show up in about, you know, he said 14 to 18 months, you know, and then they turned up positive, and how devastated I was, you know, or if anybody follows me on social, when the bark came on my kid's back and he was doing the best he'd ever done in his life. And so I was like, okay, all right, we're getting into you know, dealing with that infection. So family commitment to treatment, you know, this is a dividing mental health. Okay, we're going to say mental health, even though it's a physical problem, is a divider amongst families. People have a lot of strong opinions about mental health. Like, you know, people will say to me, like, I'm like, my kid's not going to go to college. He's going to do this. And they're like, oh, you're Dr. Roseann and you have a doctorate. And I was like, yeah, he's got a plan. He's going to do something else. And that's okay. And they're like, why would you limit him like that? And I'm like, why are you limiting yourself? Like, why is that the only thing, you know? And then I love to tell them, like, one of my friends has a $500 million company. She went to high school. So I love to tell them that. Then they ask me what she does. And I'm like, she was a daughter of a maid too. So, you know, we have to start thinking differently, and we don't always have to tell people what our plan is. You know what I mean? So people like to ask me because they have an opinion. People are in crisis. It's a lot harder to make decisions when you're in crisis, but I can tell you that be strategic and do what you can to treat the infection, calm the brain, and address behaviors. Do what you can. Okay. Nobody's perfect. All right. This is a lot to absorb. And that's where using your resources strategically is important. I love these groups. I love the Facebook groups. I think there's a lot of stuff. When your kid is emotionally and behaviorally dysregulated, it's hard. It wears you out. And these are, and people don't want to work with families and kids like this. They have preformed notions. This is why we need more literate providers. This is why I do these, you know, trainings. I try to train as much as I can. So pulling it all together, and I'm going to look at some of these questions, but we got to calm the brain. Hello, if you didn't get this out of this presentation, I don't know what you got, right? So no healing, no learning, no attention, no thinking can occur without a calm brain. That's the way it works. It's called psychoimmunology. So I empower everybody to be the CEO. My autism moms and my PANS moms and my Lyme people, they're equivalent of geniuses. I mean, they come in with so much information. I appreciate that. And I love my families that have these amazing open dialogues. Like, I heard this, and I learned about PANS from one of my moms. You know, I learned about MTHFR from an autism mom. You know what I mean? Like, so, and yet I'm studying and learning. It was a very different time. Find somebody who is a trained provider. Do they need to be perfect? No. But somebody who really can help you, is willing to grow. Like somebody who's here today said that their provider she gave them called their office, and they are signed up for my BCIA webinar. Awesome. Focus on those brain keys, you know, detoxification, lifestyle, lowering stress, you know, gratitude, prayer, all these things can be really dramatic. They're science-based. Focus on stress reduction. I mean, 10 minutes, people. I'm not saying go get a massage. I missed my massage this last week because I was sick, but I'm doing something else. You know what I mean? Taking a bath, doing whatever. And you have to incorporate integrative treatments. Integrative treatments have a lot of science behind them. Don't let anybody tell you they're pseudoscience. It's just not true. And always have that strategic plan. And of course, I think everybody should do neurofeedback and PMF, but they have been amazing resources for my families. So I have this awesome download. There's me and Gabby. So I have my diagnosis checklist for anybody who wants it. You go to drroseann.com/PANS webinar. You're going to get it in an email. So make sure you look for the email. And you're going to get my awesome Get Unstuck video with Gabby as we talk about our PANS journey. We actually give a lot of really good tips in there. So that's just a free gift for you guys to have that and get some information. And we only work with people that apply to us. And I have to make sure people are ready for the transformation. And we only take a very small amount of people every month. That's just the way it is, because I'm really working very hard to change mental health on a much more national level, with a lot of initiatives at different ways for different people. So, and look for a TED Talk this year. These are all my research. I have lots of research about neurofeedback. There is a blog that's coming out about the research in all the areas. Oh my God, it's 1:30. I apologize. I hope this was really, really helpful. There's lots of different ways to regulate the nervous system. And I'm not going to tell you that any one of them is bad. There's DNRS and GUPTA and all this other programs. If it resonates with you, do it. So, and I think it's hard for people to make these decisions. If you have any questions, you are welcome to email Aspire. You'll have my email if you sign up for that. You can respond back. We are really good at answering questions. I just want to say, wherever you are on your healing journey, there is hope. And this Aspire and what they do shows us the way. And if this is in your healing path, that's great. But you must calm the nervous system. You are not going to heal. Your child is not going to heal if they don't do that. And that's my biggest takeaway in all of this. So I appreciate everybody. You all stayed on. So I would love to, what was your biggest takeaway? Drop it in the chat. And I just want to say, as another, from one PANS mom to another, you really can get to the summit. It's possible. So I'm sending everybody a lot of good juju, and I hope this open your mind to neurofeedback, PMF, and other ways to calm the brain.
Thank you very much. Do you have a client, or do you need to go?
I can answer questions. Right, I just didn't know if you wanted me to go on forever, so I felt bad. So
I think the number one question, you gave the website to, if they want to have someone more local to them and they don't want to use a
bcia.org.
But what questions would you ask when you get somebody on the phone? What were your, what questions?
How many people have you treated with PANS? That's what I would ask.
And then would you say which kind of neurofeedback do you do so that
yeah, I mean, I would say what kind of neurofeedback do you do? And I mean, it's part of why we did all this remote work is so that we can send people equipment because it's just so hard. But yeah, what kind of equipment? I don't think you can't ask us like, what's your success? What's your research? Now, no, there's no research specifically in this, but you can say, how do you work with families with PANS? Right? Like, what's your style? Is this an a la carte where you're only coming in for neurofeedback? That's okay if you have behavioral support, right? It's very, very unusual to, I have a blog, somebody's asking, how do you get a PANS diagnosis? It's on the Aspire website on how to get a diagnosis. But I also have a blog about what tests to ask for basically Lyme or any infectious disease. Again, you're not going to get diagnosed just off of that. So I think your question becomes, what's your expectation, right? So your expectation from neurofeedback should be that, you find a provider, you like, wow, they're not afraid of challenging cases. They've worked with OCD, right? Maybe they don't even understand what PANS is. I don't know what to say about that. Maybe you're living in Iowa. People call me I have a lady that has to fly in from France because she's like, there's only woo-woo and hospital. That's it in France that does neurofeedback. And she's like, it's not a big deal for me to fly out here. I'm like, okay. You know what I mean? It was cheap in the pandemic to fly. I was getting first class tickets for $500. So, so she would just hop on a plane and there we go. But so I think what you have to do is like, if your kid is a flaring kid, it doesn't matter if it's psychotherapy or neurofeedback or physician, are they able to handle dysregulated behaviors? I think that should be your question. And what's your experience? So like when I do a protocol and I have a PANS kid, they have 2 backups right out of the gate. So I expect the PANS brain, the infection brain, does not work in predictable ways. But because I've done so many thousands of brain maps of people with infectious disease, I now know how to predict the unpredictable, right? So I'm not telling you those people to be perfect, because people are going to other providers and getting good results. Like, I'm not full of myself. So I know that, right? So you want to make sure that they're okay with dysregulated behaviors. I think that needs to be one of your top questions. And, what is your plan when the first protocol doesn't work? Maybe you ask them to watch my webinar. It is the most watched webinar for BCIA, which is pretty telling because there are so many people afflicted by infectious disease, right?
Yeah. So if you have a sensory kid with sensory sensitivities, how do you get them to wear the ear clips?
Yeah. Okay. So we have a sensory protocol in our office and we screen everybody for sensory issues. And I can just tell you, so one, there's the brain map itself. So you need a provider. We do a whole walk you in, right? We have people do a swim cap. We do that. The clips. So I have a really high flare case right now. And the mom was like, we're doing neurofeedback. And I'm like, no, you're not. So the brain map was like, I was surprised that downstairs didn't call the cops. We don't care. We're like, we're like, as long as everybody's safe, it's all right. Right. We're like, don't feel bad, mom and dad. Like, well, we got it. Right. And so we did PMF first. And then what I did is I sent them home with a pack. We send you home with old clips with paste and we see. And then we use Likert scales, like 0 to 5, like how hard was it? And then we wait until you can do that. You have to take it. You really should have a pre-trial. Some of my people need, if they're local, they have to come. I walk them through. We do a practice session. You got to expose people to it. And I find that when any kid who's struggling, okay, they love learning about their brain. I explain it. I say, listen, give it a try. We talk, we walk through it. I paint the picture. They're usually pretty okay. It's been pretty rare. I've had some very active cases. There's definitely been times where I'm like, we got to back off and let's do this and then come back to it. It really sort of depends. And I think all of us have experienced that in the treatment with our kids, is sometimes this is working and then they can't handle it because of a flare, and then we have to do something else and then come back to it. We always want to use in our flare care plan what worked before, and you want to keep that in your plan, you know?
Right. For the kids that have PANS with selective mutism, or they are sort of so shut down that they're low verbal, or we have the kids with the autism and the PANS that are nonverbal, how well can they access neurofeedback?
Yeah, so those are two different kids. So I have lots of experience with low verbal and even cognitively low, PANS, cognitively low verbal. I often start with PMF, and the only person who can't use PMF is if they have a pacemaker. So I learned to screen for pacemakers, even with really young kids, especially with autism, so that we get them to regulate their nervous system. I often will have an exercise plan that's, you know, crossing the midline. There's lots and lots of ways to do it. And then for your second question was so cognitively low, and then what was your other question?
Just nonverbal autism.
Nonverbal. Oh, selective mutism. So I'm one of the only specialists in the state of selective mutism. People call me all the time. Neurofeedback works with selective mutism. I have never, ever had a kid with selective mutism that I couldn't get to talk in public. How about that? Neurofeedback and counseling. Yeah. Together. Can't have them separated. Don't come to me with just that. So it is such an extreme form of anxiety. That's all the selective mutism is. It's just that, you can't sit down and do talk therapy with them. Like, people just don't handle it well. Their nervous system is so hijacked, they shut down. I look at things as like, it's just, are they shut down? Or are they not? If they're shut down, how do we get them unshut down? You know? And sessions are 30 minutes approximately. Very, very young children, I just need like 8 to 10 minutes, you know, and then I work them up, which freaks people out that they're doing that little. But as long as I can get 8 to 10 minutes in, I can work them up. And some of my really dysregulated little kids, like I have a little kid with autism. So developmentally, he shouldn't be sitting for a long time. He's 6, he's autistic, and he's got PANS. So, you know, we had to do a whole behavioral program. We had to get everything ready. We had to give them prizes. We got it. We get it done. If parents are really willing to do that work with us and partner with us, it's going to happen. You know what I mean?
Yeah, I do.
Yeah. We don't mess around over here. I'm like, oh, I don't want to hear that somebody's not going to do it.
Right. I mean, if they're really, really not going to do it, you can't do anything about it. But
no, I mean, that's where I had somebody who, you know, turned out it was a physician. He called me and I go, where's the rash? He's like, what do you mean? I go, does he have, looks like striations? Yeah. I go, your kid's got a tick-borne infection. And he was like, oh my God, he won't go to school. He won't get out of his bed. So we did PMF while he was sleeping. That's what we did. Yeah. So, you know, and his dad's a physician and still nobody didn't have the right answers. It happens every day, you know?
What's the difference between a QEEG and Neuroquant?
I don't know what Neuroquant is. It's just probably a way that they analyze it. It could be a form of a QEG. I don't know it. There's a lot of technology. Yes, I work with young adults. I even work with adults. I don't like to advertise it because adults are difficult. Kids are never difficult. It's just, I don't never personalize their behaviors. Adults are difficult because they limit their growth. They're afraid, their fear of change stops them from changing. So, but we do work with adults, and we have adults that work with, that have PANS. I mean, all the time, you know what I mean? So especially OCD. That's usually the number one that brings them in, is the OCD, that they get so fear hijacked and it came out of nowhere. And where they have panic attacks.
Right.
That, you know.
So for the ERP question, as we know, it can be very hard to get the child to participate in the ERP. So can you talk a little bit about how, even if the kid's not participating actively in that therapy session, how important parent management techniques are?
Yes. So first of all, it is natural for a child or any person with OCD to be afraid to not perform their mental or physical ritual because they're afraid the bad thing's going to happen. That's all that OCD is. You're afraid the bad thing's going to happen. So that is normal. And what ERP does is, number one, it's about psychoeducation. It's psychoeducation for the child. It's psychoeducation for the kid. And for the parents. And that is mind blowing. Like, I hope when you saw that part of it, you were like, oh, I didn't understand why it was so important. So that's one part of it. But the other part about it is a 1 hour session, 1 or 2 days a week, isn't going to work miracles. The rest of the time, you have to do your practice, which is homework. So you have to do you stop accommodating. We teach coping skills. We give you the exact verbiage. That's what ERP does. We are working on forming an OCD parent group just because it's so hard to find a provider and we struggle. So when people work with me, I can get people into places they couldn't get into, but finding a mental health provider, sometimes I have to beg, borrow, and steal in another state. And some of my people are forced to come out here to do therapy, which is terrible because for people in other states, not countries, we can do therapy in another country, but in other states, unless you're licensed in that state, like I'm licensed, we have New York and Connecticut, then you can't practice over lines.
Right. And for one thing, when looking for an ERP provider for the OCD, my suggestion is, and this coincides with IOCDF and what they say,
IOCDF
is that when you look on a list, if you haven't gotten a recommendation from you or whomever, and you just ask them, how do you treat OCD? And if they start with anything but we use ERP, gracefully get off the phone. If they start to say things like, we use a little bit of this and we use practices of CBT and we do this very gentle approach, like
I'm working with OCD for 30 years, you know, and I find this. And so ERP gets it done, you guys. It dismantles it. So IOCDF and Anxiety and Depression Association of America, you can search, and IOCDF lets you put in PANS PANDAS.
Right. And even then, sometimes, even if not all, some of them do pretty well with, even if they don't have the PANS PANDAS checked off.
They do. Yeah.
But it is hard. And it is one of the tougher things you do as a parent, is to not accommodate all of those, all terrible. Plus you don't always realize, like you said in your talk, how much you're doing it, because they're very tricky and they may have been doing it for a while, so you don't even know that.
So tricky, so tricky. And you might even know what this obsessive thought was, and then they bring it in like this, you know. So yes, can ERP activate? Yes, that's why we do neurofeedback and PMF, because we're calming the nervous system. And you saw in that graph, I create an increase in the activation initially, then it goes down. But every time you accommodate, all you do is move the baseline further and further up. And that's where sometimes our kids, like, they get better with their medical treatment, but we haven't addressed that and it gets worse. So, you know, the finesse of that clinician has a lot to do with, you know, there's a lot of variables in psychotherapy, and quality of the person is, you know, of that provider is a big part of it.
And like you had mentioned, you want to start with some low-key issues. You don't necessarily tackle the big beast right away.
And an untrained ERP provider, just like an untrained neurofeedback provider, they try to go after the big beast. That's the worst thing you do. The person's like, forget that.
Then it puts you in psychosocial stress, and psychosocial stress puts you in
exactly. State. Yeah. You know, you've got a kid whose primary problem is contamination, and they're not eating because of contamination. situation and that's the first thing you address, they're going to run for the hills. It's never going to happen.
Yeah.
You know what I mean? So you'll find something lower, and you think as a parent, you know what all your kids' obsessions and you don't know anything.
You really don't.
When that person gets in there and pulls it out, you're going to be like, it's like the clown car.
Right.
Like how many clowns are in there? You know what I mean?
Right.
It's the same kind of thing.
Out. And so that's the thing. Like, so even if that kid isn't able to do a lot of the ERP work, knowing as a parent what, I don't know, even 50% of that kid's obsessive intrusive thoughts are, that you are completely part of that accommodation and making the cycle worse. When you start to know what some of those are, and then develop a plan of what you are going to start not accommodating, and then holding tight to it. I mean, I've gone through it as a parent and as a patient that's done ERP, and ERP is really hard. It's really hard. But let me tell you, the OCD is way harder. Like, I had way harder with chicken. Yeah. And so going through all these steps, but like, I mean, I almost passed out from stress in a Whole Foods because there was chicken everywhere, raw chicken everywhere. And I called my therapist. I was like, yeah, this is it. Like, this is way harder than any of the stuff you're working me on. So like,
that was your point. Yeah, like where I was like, I'm done with this.
But I'm an adult that watches it and talks about it all the time. And I knew my limit. It was like my rock bottom.
Yeah.
Like, you want to try to not have that. So it's very important to get it started. So, and it can be really hard to get an appointment. So
so hard. I had people waiting 8 or 9 months in the pandemic. And so NOCD has had mixed results for some of my people, but it's a real option and they are doing good training. It's like anything else. I have the worst time finding qualified therapists for a lot of reasons. I mean, we only, but it's hard to find a good therapist, period. But you need to go, if you have OCD, you need to go to a specialist in that. And most of the people who do ERP are pretty dedicated to it. And if anybody has ever done the BIDI training, it's like through internet IOCDF, they know what they're doing. Like our staff has done that. So it's very, very hard to find. You could just Google NOCD and it will come right up. But it's, very, very hard to find people. Therapists don't like ERP because it's so structural and it's not all feeling-y and it shouldn't be. It should never be. It should be very, very structural. So I know there's a lot of questions about what do I do with older kids and hope. And, I think that's where therapy is really important, and somebody who really gets medical problems, even if you can't find somebody who does PANS, because that can be a needle in a haystack. What about somebody who's really lost the quality of their life for medical reasons? Because you have hope. There isn't a magic wand, people. It starts with something micro. And I've worked with people who come in here as young adults in their PJs because they can't get out of their PJs, and who are smoking pot every hour on the hour. And, you just have to find that little thing. You cannot force anybody to do anything, but there are techniques. We use a lot of somatic therapy for very depressed, broken down clients. We don't just use ERP. I mean, we use really effective techniques that are body focused. And instead of focusing on the cognitive components and talking therapy, it's really a waste of time in a system that is completely underactive or overactive. You have to have some level of regulation for a person to build upon skills. But you have to start small, and that's our expectations. We use, in our program, we use an analogy of a mountain, and we talk about base camps because people came in and thought, just like any provider, like there was something in one of the threads recently where they were like, the doctor doesn't call me back and this, and one of the other mothers stepped in and was like, what's your expectation that they're going to call you back every single time? So we have to do our part too. We have to have providers, right? I couldn't be responsive before until I changed what I was doing because I was seeing 4 or 5 times the amount of people I was seeing. So, and you know, you have to manage your expectations, but we always have to have hope. We always have to hold the vision. And we have to be, so we can't over focus on the problem. We have to focus on solutions. And we can't just be like, oh, you know, you go to a provider and you are just getting this medication, it's going to fix it. I don't have to do anything else. You know, this leaves a wake in its path. You know what I mean? And even on the siblings, right? Well, I didn't even mention the siblings, right? And the people and stuff like that. You know, I mean, anybody who ever hears me talk, like I have such a loss of friendships in my life. They weren't really my friends, but these are even freaking licensed therapists abandoned because they just really, truly didn't understand mental health. How sad is that? So there's a reverberation that hits us all, and we still have to be really positive, but we also have to have real life. That's why I was like, PANS in real life. Like we have to deal with these behaviors, and they're not always pretty, especially when flares happen.
Yeah. And, you know, life has changed for that child, and you show that as a parent, your life has completely changed too. And you make those lifestyle changes, but you keep doing it in that positive way. And you just try to be that example, even if you go into the car and scream on the top of your lungs around the block, like and then come back in a little calmer.
Well, our kids co-regulate off of us.
Yeah.
That is a reality. And that's why I mean, you know, in the beginning, you know, we're talking a million years ago, you know, my kid had Lyme and I knew about Lyme. I had already been working almost 10 years with people with Lyme. What did I think? I thought it was a sprint. I didn't know it was a marathon. Okay. And so you have to make the daily self-care. And even when you don't got it together, you have to have those conversations with your kid. Like, you know what I mean? Something really sad happened to me last week, like really sad. And my teenager came down, my PANS Max, and he was like, what's going on? And I was like, people suck, Max. And they always say, but he was like, what happened? And I was like, somebody betrayed me. And he was like, oh, well, tell me all about it. And he listened to me. And I was like, you know, Mom, she's going to get over it, but I'm going to take a couple days. I'm going to grieve it and feel kind of sad. He was like, okay, you know. So, you know, it was great. And I let him know I'm a freaking human being, and real stuff happens. And I know that I'm not perfect. And I've been the lady who's had the breakdown in the middle of BJ's, as I always like to talk about. But we have to be on the other side. We do have to try to keep it together. And I think the hardest part about PANS is you're in the rabbit hole. Yeah. And you are like, is this the thing? Is this the thing? Is this the thing? I think there's a lot of things that are very effective. And I hope when we talked about this 5-pronged approach, you do really have to do all 5 parts. And I wish you didn't have to, you know, treat the infection, calm the brain, and do all that. But guess what? Other than the infection and you know, the other part of all these things we should be doing anyway for brain health, for quality of life, you know? And so I think that is, you know, something we're not talking about. So sometimes pain brings amazing things in our lives. I hate freaking PANS. I hate Lyme disease, but boy, has it brought some blessings into my life. And certainly has cleared the riffraff out.
Yeah.
Right?
Yeah.
For sure.
Yeah.
But for all of you that stuck with us for all this time, I think it's pretty amazing. And I hope, you know, there is a takeaway, and I hope that you really do feel more hopeful and less overwhelmed. Right. And just start small. And, you know, what can you do? Maybe it's for yourself getting up. Like I said, I'm getting up earlier. Maybe that's what you need to do.
Pick 1 to 3 things. That's it.
That's it.
Let the rest go.
Yeah.
And the same for those teenage kids who you kind of have to say at a certain point, this is part of your choice.
That's right.
Do it too. And I know it's very hard to do it when you're this depressed and this anxious.
Yeah.
but pick one thing. You can't.
That's
pick
right.
things. You were doing 100 things before, so was I. And now we're going to, as a family, pick way less things. And I'm going to do that as a mom for my own things and talk about those things as a mom.
Right.
Like today is a rest day and I will be doing
Absolutely. Absolutely. And you know, what's really interesting is like, and I'll leave with this, we all had COVID on our holiday vacation.
Of course.
And of course, but it's okay. We're at the beach. It was all right. And I said to Max, listen, this is the first time you've been sick in a long time. You could be like full on out of your mind. I don't know what's going to happen to you, but we're going to be prepared. And we're going to do this, and we're going to do this, and we're going to do this. And that's not going to happen. That is not what's going to happen to you. Be prepared. You're going to feel crabby and irritable. I don't want you swearing. I don't want you doing this. I don't want, and you know what? It was like the best he had ever been with any minor illness, big illness, anything. And I was like, I am so proud of you because you're really sick. And he was like, oh, Mom, you told me to do the sauna. I did the sauna. Oh, you suggested a bath. I went in the bath. And he was just doing it on his own. And I was like, it's a miracle.
Right.
It's all come together. So you can't give up. You got to keep pushing. Even the ones that are the glass half full, the glass half empty kids, because sometimes there's disposition in this. So anyway, I know for all of you that have stayed, as I said before, blessings, and I appreciate it. And I do have an appointment now.
Yeah, so do I. Thank you very much. And it was
my
great
pleasure.
To spend the day with you. We're part of the day with you.
I know it was. It's always a pleasure to see you. Thanks for all your hard work.
Thank you, everybody, for coming.
Bye, everybody. Be well.
Bye.